morning, everyone. Danse. My name is Arlene Bertar Hewitt. My ancestral name is Arlene Rosemary Gervais, which comes from a long line of Métis in Canada. And I am going to start us off with a smudge, which is traditional for our Indigenous people across Canada. And I would like to invite you when I begin to please stand. And then I'll say a prayer on our behalf. And just to let you know that doing this online is very unusual, and it's difficult because you're not actually in the circle of the smudge. So I'm going to try to simulate that as much as possible to include you as part of that. When I start that smudge, I will do just a small bit of teaching as well, and just to show you some of the things that are very meaningful to our Indigenous people across Canada, and for the sake of the smudge. So first of all, I would like to acknowledge that I'm coming to you from the unceded territory of the Silks Okanagan people, and we are very honored to live, work, and play in this unceded territory. It is also known as Region 3 of the Thompson Okanagan Métis Uncharted Territories, and we have 39 uncharted regions here in BC. And so that is just some basic, I guess, territorial information. There's always so much more to be learned along those lines. Okay, so I'm going to start now with the smudge. And you can let me know if you're getting a good, decent view of this here. Are you able to see that?
Yes.
Okay. So I'll just talk to you about some of the things here that I have on my setup here. This here is a hide bundle that I call my bundle, and I wrap all of my things in there. And when I would travel and I would do the work, this bundle would come with me everywhere. It is natural hide, and tied, of course, with natural hide as well. You can't see the underside of it, but there is a buffalo painting on the other side, and also a braid of sweetgrass on the other side. I have here my Métis talking stick, and this Métis talking stick has been used in many healing circles that I've conducted, I would say across Alberta, Saskatchewan, and BC. And this one was gifted to me quite a few years ago from my now deceased older sister. This here, I have this on a blanket, and this blanket was presented to me actually just the other day. And it's a beautiful wool blanket. And blankets are a very meaningful gift to our Indigenous people. When you're wanting to honor someone, a gift of a blanket is well received. I also have here the last medicine pouch that I made, and this medicine pouch contains the medicines and also something that is meaningful to me for praying. And you'll see this from time to time on people, our Indigenous people, and they have in there the medicines. And when I say medicines, what I'm talking about is the braid of sweetgrass here. That's one of our medicines. And this is cedar. That is another one of our medicines here. And this is sage. And we have sticks of sage that are used by many of our Indigenous people for smudging, and this is one of them here, and this is another. And I have many sticks of sage that have been given to me. This one was also a gift and was all wrapped, and it's wrapped in cloth and given to me by someone for the smudges. And I have here also my folder for carrying my feathers throughout my life. I've been gifted with many feathers, and this feather folder was also a gift that was made for me. And so all of these feathers are very significant in that they've been used in healing circles, and those healing circles have processed a lot of pain in our Indigenous circles. And so the eagle feather is very special to our people because the eagle flies high. It has a symbolism of a spiritual symbolism for us, and carries those helps to carry those prayers to your Creator. And so I'm going to use this feather today to fan our smudge, and I'll do a mixture of all of these medicines for us today. And I also have this Christian cross here because I am also a Christian. And it's important for me to mention that because for our people, that crossover of being a Christian and praying in the traditional Indian way is not strange to us, because my people were Christian people in the 1600s, long before residential schools ever came into being. Anyway, I have brought this special knowledge into many communities, and was actually thanked with an eagle feather by one person in the Ermineskin First Nation in Alberta when she asked to speak to me, and she was so appreciative that she now knew that we could pray in both ways, because before then she had believed if you pray in one way, then you can't pray in the other, and yet it takes you away from the way we were prayed from the beginning as Indian people. Okay. So I'm going to start mixing up our smudge. So I'm putting a little bit of cedar. Like I said, I don't want to put too much and have too much smoke because I have a smoke detector here. One thing we try to do too is we try to light a smudge with wooden matches because it's as close to being natural as we can possibly be. And so we try to stay with that tradition. So I'm fanning the smudge to get it going. Give it some air. And then I'm going to smudge the feather in 4 directions. I'm going to wash myself with this smoke. My heart, my body, my hair. Smudge my glasses, my ring, my jewelry. A lot of times some people will even go so far as to remove their jewelry, remove their glasses. But these days, you can just smudge it in your smudge if you wish. So I'm going to bring this smudge now to you. And I'm going to fan the smoke into you. And you can think about us being smudged. I'm going to say a prayer for us now. Great Spirit, whose voice we hear in the wind, hear us now, for we are young, small, and weak. We seek your wisdom and your strength, O Great One, not to be superior to our brothers, but to conquer our greatest enemy, ourselves. May our ears be sharp to hear your voice in the winds. May my eyes be able to see the lessons that you've hidden in every leaf and rock. May my hands respect the many beautiful things you have made, so that I may learn and carry the message of life and hope. May I always walk in your beauty, so that when my life fades like the setting sun, my spirit will come to you without shame. Hi. Thank you.
Thank you so much. I'm just going to sit down. Elder Arlene, that was beautiful and innovative in that you were able to share that smudging with us online. Thank you so much for teaching us already. And just as we start. So as we begin, I'd like to say thank you to both Elder Arlene and Elder Ethel for being with us today. We really appreciate it. My name is Allison Schneider, and I am the Education and Training Manager at AgeWell, Canada's Aging and Technology Network. AgeWell and Epic AT are honored to present the session entitled Fostering Cultural Safety in Health Research, Insights from Indigenous Elders and Allied Settler Researchers. Today, we will hear our panelists share personal journeys, stories, and insights into why cultural safety matters, what it is, and how to enact it in research partnerships with Indigenous communities. To reflect on what was posted in the chat as we just started, I ask that you participate in this webinar and discussion with an open heart and in a good way as we come together to learn from some of the first peoples of this land that we now call Canada. Our panel plans to speak for about 1 hour today. We hope to have time for a few questions after the roundtable. Please post any questions or comments in the chat box, and I'll open that up as soon as I'm done speaking. This webinar is being recorded and will be available for replay on AgeWell's YouTube channel. Closed captioning for this webinar is available on the Zoom platform that we're using today. So you can see the 2 C's or the CC icon on your Zoom menu. If you like, you can click there to enable the closed captions. If you select this, you will see a white script on a black background with the captions. So please note that they are automatically generated, so there may be some inaccuracies. Without further ado, I would like to briefly introduce our panelists. We are honored to have with us Elder Arlene Bertar-Hewitt, a Métis Cree woman from Saskatchewan, who is currently engaged with Métis Nation BC to deliver suicide prevention workshops. We are equally honored to have Elder Ethel Starblanket of Starblanket Cree Nation, who holds the role of life speaker for her First Nation and sits on 3 committees for the File Hills Tribal Council. We also have with us Dr. Charlotte Jones, who is an endocrinologist and researcher and professor at University of British Columbia's Southern Medical Program. We also have Dr. Vivian Yozeski, who is an assistant professor at the University of Northern British Columbia's School of Nursing and an EPIC AT fellow. And last but not least, we have Dr. Kari Dawn McKilduff, who is an assistant professor in community health and epidemiology at the University of Saskatchewan. Okay, thank you so much for listening. I will now turn things over to Dr. Charlotte Jones.
Thank you so much, Allison, and welcome to all. Thank you again. I am so honored to be part of this group of astounding women. Elder Ethel, thank you for your teaching, your knowledge, and your opening prayer to open this in a really good and beautiful way. Thank you. It's my job now to introduce the concept of what cultural safety means to you, especially with respect to research. As cultural safety is about the experiences of people that we work and do research with. It's an outcome based on engagement that recognizes and strives to address power imbalances inherent in the healthcare and research systems of our country. It results in an environment free of racism and discrimination, where people feel safe when participating in research and receiving health care. So with that in mind, and Elder Ethel's beautiful opening, I ask that you enter into the chat box what your thoughts are or answers to the question, what does cultural safety in research mean to you? And hopefully, if you are able to enter it in 50 words or less, if possible. So I'll start by asking some questions, and we'll go through each of our beautiful people here today. And so I will start off with the first question and ask Elder Ethel if she's able to answer first. What brings you to this work or understanding of it, and why is it important to you?
Good morning. Cultural safety in the health needs for Indigenous people need to be addressed and implemented accordingly. There are unnecessary incidents in the healthcare system that has happened over the years due to being unable to understand the person's history. Indigenous people are affected by government policies, and the process of efficiency and misconception of the needs of Indigenous people are still unrecognized. There needs to be a full understanding of history, tradition, cultural practice, and language, and meaningful communication between the people and the program services, and the delivery has to be facilitated 100%. I believe that if we work hard enough, we can reach the goal of coming together and making this a more safe place to work together for our Indigenous people.
Oh, thank you, Elder. That was wonderful. Elder Arlene, what are your thoughts on this question?
Well, thank you. I don't have much more to add to what Ethel has already said about this particular question. Same thinking that, cultural safety to me would mean, wherever our Indigenous people were involved and in whatever, whether it be a research project, a webinar such as this, a circle where, community in a broad sense, we're meeting together, wherever our people were gathered, that there be at the top of that respect. And respect for who we are as a people, and a recognition of what we've gone through. And if there's a recognition of what we've gone through, then there wouldn't be such a judgment and discrimination for where some are now. Many of us have had the opportunity, and includes myself, to do a lot of healing work, and to put away those old ways of coping that were unhealthy, and now I'm able to live a life that is a well-balanced life in all aspects. And I recognize that not all of our people have had a chance to do that. And that's what my work has been all about, is going about and helping people to do that healing. And I'm very committed to that process. But I look at some of the atrocities that have happened to our people in hospitals, in the healthcare system, in different areas of mainstream activity, where there has been judgment and discrimination because of where they're at. Mm-hmm. So culturally safe is that, to me, is where that you're in a space a safe space where that does not exist for our people. We're just all there as a fellowship of human beings.
Oh, thank you. Thank you very much, Elder Arlene. A safe space. Carrie, how about your thoughts as a researcher? And
Yeah, thank you, Charlotte. Thank you, Elder Arlene, for your prayers and teachings this morning. And thank you both elders for your really important words. I think for me, cultural safety means listening to those words and hearing those words and hopefully making more space for those words to be heard. For me, cultural safety has really come out of a space in which I became a mother figure of two young Indigenous women at a very early age and had to advocate for the many barriers that they had to overcome in all systems as their mother figure. And I guess as my journey has become, it's really motivation to make the world a better place for them and for their children and a safer place for them. Internationally, I've worked with Indigenous peoples. I've worked with them, walked with them, and that walking with them and living with them is where I have learned the most about what cultural safety means. And what I've learned from elders and community members alike is that that also means being trauma informed and really making more space, for that those voices to be heard. Also for me, that recognition of we co-created a model together with a bunch of different Indigenous communities after listening to the harms that are continually being done by research and by institutions. We co-created that model, and one piece that that was part of it that I didn't recognize that now communities have told me is the recognition of power and privilege, and that recognition of the myth of meritocracy. And so recognizing our power and privilege, but also how I have hold power and I hold privilege, and how that then further oppresses other people, other equity deserving groups. And so that is something that I am working towards and teaching towards with students as well. So thank you.
oh, thank you. There's so much wisdom here today already. Vivian, your thoughts?
Well, thanks, Charlotte. And let me just begin with saying thank you so much, Elder Arlene, for your opening prayer and your smudge. It's very much appreciated. And so for me, cultural safety and my journey on the road, I guess, to cultural safety really stems from, I think, personal and professional experiences and really a deep-seated commitment to doing work that will foster social justice and equity in healthcare, because cultural safety is part of that, as well as a really deep belief that Indigenous elders, communities, and people are really the rightful experts of knowing what Indigenous health and well-being is and how to promote it. And that also, for me, is part of cultural safety, to have an understanding that there is a role for me to play, but I also acknowledge at the same time that this role needs to be done in partnership with Indigenous communities and Indigenous peoples, and usually at the invitation of Indigenous communities. So I am very excited to be part of this circle today and to sit here with two elders and have the opportunity to learn from what Elder Arlene and Elder Ethel have to share with us today about that very important topic of cultural safety.
Oh, thank you, Vivian. There is so much beautiful knowledge being shared today. So our next question, starting with Elder Arlene this time, why is it important to deepen researchers' understanding of the realities of past and ongoing colonialism, which came up, of course, already, how important understanding and respecting history is?
So admitting to a colonial way of thinking and doing things is very difficult.
Mm.
And not only can that be said of the colonizers, but also of the colonized. Having come through those harsh times of being extremely oppressed, to a new understanding that what happened to our people was wrong. As a people, we now have to rediscover and renew a commitment for our people of having pride instead of acceptance of that harsh treatment.
Mm-hmm.
And many of our people are not there yet, as you can see by some of the stories that we see, coming out of, stories of. I'm particularly drawn to a story of a young woman that was in terrible pain in a hospital, and somehow she was filmed during that horrible time, and that was in a hospital where there should have been caring and compassion, and instead, was treated so poorly, and obviously discriminated against, and there was blatant racism there. And so that's just one example. We have that happening here in our BC territory too. And I was just talking to one of the doctors that's highly involved with us, Dr. Kat, Charlotte, and Vivian, and he was telling me some of the stories of, he works with Indigenous women, he delivers babies, and he has some very, very shocking stories of what is still happening to our people in the healthcare system. And it's shocking. Most people that are not touched by this will have a hard time believing that, but it's happening, and it's happening every day. So our people too must expect to be treated with respect, instead of the way it used to be that we would accept that. We need to demand this respectful treatment and know that it's our right to receive it. An apology about that was just put forth by the National Nurses Association, where they admitted to the discriminatory practices and treatment of Indigenous people in the healthcare system and by the nurses. So, one would wonder, how does a profession that is trained to have compassion and caring for all people come to that point?
Mm-hmm.
So we know it was because of the permissiveness and acceptance of this treatment by the whole of white society, the colonizers, and within that profession. So I say that researchers then have a responsibility to educate society and to ensure that research is conducted in an inclusive and continuously respectful way of our Indigenous people.
Very profound, Elder. Thank you. Elder Ethel, what are your thoughts?
Well, I feel it's important to understand the meaning from which Indigenous people speak. Language and First Nations languages can mean two different things, can have two different understandings. Indigenous people speak from the feelings, from their feelings. It's called the heart language, which is hard for our First Nations to do because of the history of the Indian residential school and the education system. Traumatic effects has impacted our people, and to us, impacted us to various degrees. It's important to know about the impacted trauma and the effects, and to try to begin to understand so we can work with our people in a holistic manner. Without knowing all of the history and the background and how our people speak now, we've come to the understanding that our language can be revitalized because it's in our DNA, and you know, we still can speak from the heart, even though we don't speak it fluently. And so that understanding and the difference of what it means to us can be helpful in terms of any kind of diagnosis, whether it be emotional, mental, physical, or spiritual. We have to learn to understand that our people have to heal with their spirits. We do, as humankind, we express ourselves through how our spirit feels, and if we come to understand the spirit of ourselves, then we can express more accurately how we are feeling in all of those 4 areas. And a lot of us have to come to that understanding in order for wellness to start happening. Thank you.
Oh, thank you, Elder. The healing, the heart language, the healing heart language. That is beautiful. Vivian, your thoughts, please.
Thank you, Charlotte. I think that researchers, especially researchers in health and healthcare, really have to have an understanding of the realities of not only the history of colonialism, but also of the ways in which colonialism continues on in today's society. And as Elder Eileen just talked about the many instances in which it still impacts Indigenous peoples today when they're trying to access healthcare that works for them in a safe way. So for me, cultural safety is really about requiring this understanding of the fact that healthcare played a huge role in colonialism. In, for example, having Indian hospitals, which really violated Indigenous people's rights and conducted horrible experiments and deprived Indigenous peoples from very basic rights, including access to adequate food and healthcare, and which separated and disrupted families. And it continues in many ways in that Western biomedicine still marginalizes Indigenous ways of knowing and being and doing, and in really not creating a safe space for Indigenous voices to be heard. So I think that having that understanding of how colonialism has played out in the past continues to impact people today, and also continues to manifest itself today in our very structures like healthcare that are meant to benefit people equally, and the kind of harm that still goes on because of colonialism, and that includes anti-Indigenous racism in our healthcare system. That it's just crucial to understand those kind of ways, and that it is not just about individual acts of racism, but it is about structural and systemic racism, and colonialism is really shaping how this kind of racism is expressed. So I think that for researchers to act in a culturally safe way, they have to understand those realities, and they have to understand that it is all of our responsibility to change those kind of structures and institutions that make up our society, and that are responsible for the ongoing harm and suffering of so many Indigenous peoples in this country. Yeah.
Oh, thank you, Vivian. There's just so much knowledge being shared today that should help us along our journey. Carrie, your thoughts?
Thanks, Charlotte. Thanks, everyone. I don't have a lot to add to what's already been shared with the knowledge that's already in this space. But I do want to just point out some of the things that we often think about that are different for Indigenous people. So we look at the social determinants of health. This is different for Indigenous peoples in Canada. Colonialism is a social determinant of Indigenous people's health. Racism is a social determinant of Indigenous people's health. And we need to know those things when we're working with and serving Indigenous communities. I often will talk about, this is not a history webinar, but I often will talk about the Indian Act and how that has been divisive for Indigenous people across Canada. The Indian Act was created in 1876, and it's still in effect today with only 2 adaptations, with the last adaptation only being in 1985. We are the only country that I know of, and I've done quite a bit of searching, that has a legislation in place from the 1800s. The combined effects of colonialism and the Indian Act have impacted all aspects of Indigenous people's lives, including identity, including gender roles, including traditional roles, equity, health, education. And so recognizing that is really important. If we spend so much time doing literature reviews on areas that we want to research, why are we not doing this much or more looking at the impacts and the lived experiences of those whom we work with? And so I often will talk to students about, while you can do a literature review on a topic, the population or the co-researchers that you're working with, you also need to do some education of yourself in. Thank you.
Wow, so important. And I think the message coming through is what I heard earlier: listening, understanding, and learning. Thank you all. This is wonderful. So on to our next question. Why is it important that researchers are aware and responsive to the unique health service challenges faced by Indigenous communities? I wonder, Elder Ethel, would you grace us with your response?
Okay, the government policies have to reflect change and continue to honor the agreement signed by the ancestors. The ancestors envisioned what was forthcoming and provided protection for those yet unborn in a sacred manner. We all have to suffer consequences of air quality, water quality, fire, and all of the effects. All humankind has to reconcile in order to live healthy and address all of those areas that affect us. We have to reconcile in order to live healthy. We all need to find ways in research and to work together, learn together, and resolve issues for positive changes to happen. That's how I feel.
Thank you, Elder Ethel. Elder Arlene, your thoughts?
And the question again?
Why is it important that researchers are aware and responsive to the unique health service challenges faced by Indigenous communities?
Well, I wasn't really prepared for this question. I thought that one would be put to our our leaders here. So I'll just give an answer, of course, that to me is, I think it's already been spoken to, and it's obvious that the researchers, when they're doing their research, that they're aware of our history, of those conditions that affect our Indigenous people and in different ways across Canada, and also that there is a difference in our cultures. And Indigenous people on the Coast Salish, are not the same as the Iroquois in the East. The Mohawk peoples are very different than the Plains Cree in Saskatchewan, and the peoples of Manitoba, of course, the Plains people have a lot of commonalities, but there are a lot of cultural differences. And so depending on where a researcher is doing their research, taking the time to learn about that special culture, and not putting all Indigenous people in the same pot, so to speak, and saying, well, you know, we're all alike, we all have the same cultures, and it isn't that way. You know, I've worked with our people as far east as going to James Bay, and you know, a fly-in boat-in community only, and learned about the very, very unique culture that was happening there. And you know, sad to find out that people, though way in the East, and what you would think would be isolated from the harms that can come to them, was not so. I had been invited to go there to teach the addiction workers that were working there, that were trying to help their community. And you know, I learned that there were you know, planes that would fly in with the drugs, and they were severely affected by addictions. And there was a huge drive by those folks that were working hard to help that community, to you know, to help them heal their addictions. And so not assuming that because you know, a community that has been isolated and away from you know, the effects that can affect urban folks that have that, you know, are in close proximity to those things, such as, you know, the alcohol, drugs, those things that can detrimentally affect our people, thinking that this community will not be affected by that, where it's not true. And so learning those things, and then also to recognizing that, you know, one of the things that we know is you know, definition of post-traumatic stress disorder. One of their definition is that constant pressure to a person's you know, physical, emotional, mental, spiritual well-being, that constant pressure around them, and assaults to that personhood can create PTSD. And so that pain of what a lot of our people are going through will often be, you know, alcohol, drugs are a great painkiller, and there is still the effects of being a colonized people, that many of our people are still trying to kill that pain. Again, going back to saying, you know, I've been blessed in that I've had the opportunity to heal from all of that, and you know, gone on to help other people to heal from that as well. But I see, that our people are working so hard to change all of that and to heal from all of those hurts. But there's a lot of work in front of us to be done. And so it's important for those researchers to know, yes, about our history, but to not kind of to say, okay, we know about the history, we know about your history, but go on to say how that history has affected our people, and the creation of the post-traumatic stress disorder that so many of our people suffer from. And then, of course, you can't live with that kind of pain without finally, the body giving up and saying, I can't do it anymore. And so, we suffer from high rates of suicide. We are overrepresented in the prison population. We have a high incidence of addictions. And there is a reason for that. And that's not to say that everyone's been affected in that way, every one of our people, but a lot of our people have, and there needs to be an understanding of why that is, and an understanding of the support that our people need for those projects, opportunities that help us to heal from all of that.
Oh, thank you, Elder. It's about understanding, knowledge, and compassion. Oh my goodness, your words are so important. Carrie, your thoughts on this?
I'm struggling to follow that up, Elder Arlene and Elder Ethel. I was taking notes. I think my biggest thing that I wanted to make sure that we talked about is really recognition of the myth of meritocracy, and that equity deserving populations have significant barriers to overcome that others don't fully understand. I think it's Maya Angelou who says that we don't recognize the current when we're swimming with it. But for those of the population that are swimming against it, they sure do recognize it. And so it's stopping in that current and trying to see the current that others are swimming against and supporting that swim against the current. Barriers Indigenous peoples face in these spaces in our colonial systems are unique because they're originally built, these colonial systems are originally built to either assimilate, exclude, or completely obliterate Indigenous peoples. And those systems are still in place today. I'm not going to go back into the Indian Act, but please look at the Indian Act. Look at what it still has in place, even for really excluding Indigenous people. That is a huge barrier across Canada. Some things that Elder Ethel said around honoring the signatures of the ancestors on the treaties. Something that you just taught me, 2 days ago, was I often will talk about the X's that were on the treaties, and that's not a signature. But then you taught me, and I don't know if you want to share about that, what those X's really meant. So when you talk about how something means something to an Indigenous person versus a non-Indigenous person, this is a clear example of that. And another piece I just wanted to touch on before I open it up to you, Elder Ethel, because I know you're going to have a teaching for us, is that there is significant underdiagnosed PTSD in Indigenous communities. And when we work with Indigenous communities, we need to know that either they are residential school survivors, or they're family of residential school survivors, potentially children of residential school survivors or grandchildren. And so and it's not just residential school that created the trauma, but that a lot of these PTSD symptoms, they are seen as, when you go into the hospital and access healthcare, they're often seen as drug seeking or coming off a high, or they're often seen as ADHD, or they're seen as other things because the symptomology of PTSD is very similar to a lot of different things. And the assumption, the discrimination is, oh, they're just drug seeking, and so then Indigenous people choose not to access these services because why would I go into a space that's going to discriminate me? And so I just wanted to point that out, just building on some of what Elder Arlene and Elder Ethel were talking about. Sorry, Elder Ethel, do you want to talk about the difference of understanding with the treaty signing?
Okay, the we've all come to recognize the symbol of the X as a signature, but the understanding from my teaching is that that symbol is a sacred symbol, recognizing the 4 direction teachings from where we are. We build our total faith on our belief system, the way that we are guided in our lifetime. So that sacred symbol is not really an X, but a 4 direction symbol, which emphasizes the sacredness of the way we live as Indigenous people. And that's why we say the sacredness and intent of our treaty, that's where it comes from. It's written, and we're guided by that symbol always. And we often, like as pipe carriers, we rotate our pipes to include all humankind in respect to the prayer to our Creator, and recognize all of Creator's helpers in those 4 directions. And we sometimes call them grandfathers, grandmothers, and our ancestors that have gone on before us in their spiritual entity come to help us in our prayers. So that symbol is a direct signature to the sacredness of who we are as Indigenous people. Thank you.
Oh, thank you, Elder Ethel. That was beautiful, beautiful teaching. So memorable and so inspiring to me. Thank you again. Vivian, should I reread the question for you?
Oh, I'd love to say a few more words, but I think that unfortunately the time has flown by, and I wonder if at this point we need to ask Elder Ethel, or are we out of, do we still have time? Sorry, I'm like confused now.
I think we have a little bit of time.
Oh, excellent. Sorry. So I was thinking, oh my God, the time is flying at all this amazing kind of people talking and sharing wisdom. Okay, so for me, the question about why is it important for researchers to be aware and responsive to the unique health and service challenges faced by Indigenous communities? I would say it's really important to understand that really one size doesn't fit all. And as Elder Arlene emphasized, there is huge diversity among Indigenous peoples and even among Métis communities, but also and among First Nations communities, and whether or not people living in urban areas are rural and remote. And so without attention by researchers to those unique challenges, but also to the unique strength and cultures that Indigenous communities have, it's really easy to create or promote interventions that actually create new harm or deepen existing inequities. So for example, let's take telehealth, an expansion of telehealth. It's without the consideration of the ways in which colonialism has economically and geographically marginalized many Indigenous peoples, and without an understanding, for example, that as a result, many Indigenous communities are least likely actually to have access to stable broadband internet. And also the way historical trauma and the widespread racism that Indigenous people face in the healthcare system, how this contributes to ongoing trust issues towards healthcare providers, and the general lack of cultural safety and humility within healthcare. Without all of this, and an expansion of telehealth services through research or healthcare policies, it's likely to really disproportionately disadvantage Indigenous patients. At the same time as it helps to improve healthcare and health of other Canadians. And so in so doing really effectively increases inequities rather than to help ameliorate them. So for effective, relevant, and meaningful services, tailoring is required to the unique context and the unique strength and concerns of Indigenous communities. And this in turn then would really require to work with Indigenous communities in partnership, in collaboration, and to really respect Indigenous leadership and knowledge.
Wow, Vivian, that's really amazing. And I think that brings up that concept of Indigenous-led research and the need for the communities to lead the way. Thank you so much. My goodness. So now moving to considering reconciliation. How do we envision it as a two-way street, and what specific actions can foster this research? Elder Arlene, would you like to open the answers to this question?
Okay, so we have to realize that we've come through a dark period in our history in Canada. And that history justified the stealing of land and removing First Nations people from their lands, putting them on reserves and controlling movements, taking away and outlawing the practices of celebrating uniqueness in their culture, and even removing children became the norm. And that is never happened, as far as I know, to another people in the history of the world, I believe, where children were actually removed from their families as a result of legislation in a country. So the dominant culture then can be taught that it was a history of justifying abuse and racism and discrimination. And also for our people, there was a history of justifying the hanging of our Métis leaders who tried to fight for land and for our people. That was a time of blatant racism. And if you look on history of Louis Riel, who was our leader and almost founder of our BC Métis Nation, not BC, but the Métis Nation, so that allowed the government to enforce policies that justified those killings and what happened to our people. My people were involved in my ancestors were involved in the Riel Rebellion, and it happened to a lot of our people that, the RCMP or the soldiers would come and burn down their villages, chase them out of their homes, and that was an accepted practice. And who else would have had that happen to them in this country? Those atrocities, committed to a particular race of people. And just talking right now about the Métis, and there were many other instances also for First Nations people. So today, as in this webinar, we're working with white settlers to improve the health and wellness of our collective peoples. And the spirit of reconciliation has to be alive and real in order to accomplish this on both sides. We need to have a spirit for our peoples of forgiveness. I was at a beautiful ceremony at an elders gathering in Prince Rupert, and there must have been, at one point in time, they were doing a ceremonial march, and there were probably about 500 drums playing. Wow. In that stadium. It was so moving. You could feel the heartbeat of the drum, and I was crying, and with the beauty of it, and with pride, and with joy, and that our people felt so strong and were expressing that. It was just an amazing moment. And I turned to a little boy behind me, and a little First Nations boy, and I said, "Isn't it a proud day to be an Indian?" And he said, "No, I hate it." Yeah. And this was coming from a little one. He was probably about 6 or 7, something like that. And so what had brought that little boy to have those feelings? There needs to be a reconciliation and a forgiveness, a spirit of forgiveness on our side. On the side of the dominant culture, the colonizers, we have to have the same spirit of peace and reconciliation, and knowledge and acceptance of the truth and the reality of what happened to our people, and on both sides we need to know that, and then to come together as a people. We know that we're not there yet, but with webinars such as this, and I'm not sure how many numbers of people were reaching out there, but the pleading is that the people that are watching this today will reach out. And I heard one person say, "You want to get to know us? Then make a friend of us. Be our friend." Do you want to know Indian people? You want to know Métis people? Get to know us and be our friend. And that is one of the things that each person could do for a deeper and broader knowledge of what it takes to reconcile, and it will only get better with that commitment on both sides. And it's my hope and my belief, we will never go back to that dark place again. Thank you.
Thank you, Elder. Your words and knowledge is so moving, and aims us towards relationship building. It's about relationships and understanding. Oh my goodness. Elder Ethel, would you share your thought with us?
Well, the whole structure of the Canadian government has to align itself with our Indigenous people and the sovereignty and governance that we rule by. We have our own sovereignty and governance, and we need to learn how to walk side by side with the government structure that's in place. For too long now, the different municipalities and their representatives that have been elected go into power of the provinces. And a lot of times these people don't really understand Indigenous people and where we are, who we are, and what we're all about. And so under the treaty signing, the federal government has to take responsibility and try to take care of us the best way they know how. But provincial government often supersedes all of our interests. And so every time there's an election, the prime minister that's in place is trying so hard to work with us and recognize us in all of this. And then you have the power of the people in municipal governments that are pressuring us because they don't know who we are. And it's very hard for Indigenous people to work within the policies and the structure. So now we need to also work with the Truth and Reconciliation recommendations. Where people, the way the Canadian government is structured, they have to work within those recommendations so that they can serve us better. We can provide everything that we need in a much better space, a safer space, and all of that. The Canadian government and its people have to learn to understand that we are not going away. We are resilient, we're still here, and we are recognized by the sacredness of what we have signed years and years ago.
Thank you, Elder. I hear such optimism and strength and moving forward. I see this working, but too slowly, but working. Thank you so much. Vivian, can you share your thoughts with us?
Yeah, thanks, Charlotte. And thank you, Elder Aline and Elder Ethel, for those really powerful words. And I really, it is so true. It's like, for me, when I think about reconciliation and culturally safe research, it is not something that you compartmentalize into, okay, this is what I do as a researcher. It requires people to take a stance in all your roles and just, be an ally in your work as a researcher, as a teacher, as well as in everyday life, right? Go out and make connections, go and join a community event. Find out about your local friendship center, the Métis Center, about cultural events, and join. Build relationships. That's part of being a culturally safe researcher. It doesn't, yeah. So thanks, Elder Aline, for this. And at the same time, we know that there are structures, as Elder Ethel said. As a researcher, we need to be aware of those structural barriers that keep us from moving into the broader direction of reconciliation. And I think that in research, oftentimes what we see is something that has been called the helicopter approach to research, where white settler researchers go into Indigenous communities and they engage in their research and then they leave again. And so rather than actually promoting Indigenous ownership or local capacity building, or even sustainable solutions that benefit the communities, it's actually the researcher who benefits because they get publications out of it. They might get another grant out of it. But it doesn't really leave anything behind than harm, because if you create expectations and you create, this short-lived kind of availability of resources and potentially services, you create hope, and then the research funding ends and everything is gone again. You're really eroding trust, you're recreating colonial relations, and you're just creating harm that has consequences for health and well-being. So reconciliation is really something that matters to researchers, and it's a responsibility to think through what that means in research. And it is about also creating meaningful relationships, long-term relationships that extend beyond the end of the research project.
Thank you, Vivian. So many more important words. Carrie, can you share your thoughts with us? We have to be a little bit succinct now. We're starting to run out of time, so thank you.
Yeah, absolutely. And thank you, Vivian. You kind of started us off into the next question, which is amazing.
Yes.
And Elder Arlene and Elder Ethel, thank you so much. A huge thing is for me, I'm just going to list very quickly: relationship building, reciprocity, educating ourselves, recognizing the public purview that the government or other entities create that we're believing, that is creating further discrimination against equity deserving groups, including Indigenous peoples, recognizing who's putting out that public purview for particularly Indigenous peoples, addressing power dynamics and systemic barriers, and utilizing our power and privilege to promote change, advocating for those equity deserving populations, and then fighting the good fight. So an Indigenous elder in Australia once told me, when I was really expressing weariness about the continued systemic barriers we were fighting against, for the rights of Indigenous peoples in Australia, she said, if you're feeling tired or discouraged by the fight, think of how we feel. For generations, we have been fighting for our rights. Dust yourself off and keep standing alongside of us in this fight. And I think in that moment was when I recognized my privilege that I have in choosing to fight or not to fight, in choosing to be tired or not to be tired, because those systems and those policies don't oppress me. And so my choice is to choose to use my privilege. But Indigenous people and equity deserving groups don't have that choice. They're constantly fighting that fight. So Elder Ethel, Elder Arlene, thank you for continuing to fight that fight and educating us today.
Thank you all. It is so profound, all the knowledge that everyone has shared, and the joy it brings me to learn, and to learn from two beautiful elders and two amazing settler researchers. So we have perhaps time for one brief question from the audience, if there is a question. And
hi, Charlotte. Nobody's posted questions yet. There's a few ideas on culturally safe research that have been posted there.
okay, so then in view of to substitute for questions, I will read off some of the answers to the question, what does culturally safe research mean to you? And one person says, being respectful of people's participation and contributions, and asking them how best to support them in participating in research, clinical practice, communications, etc., creating safe spaces where we value their perspectives. And I see a lot in that answer has been reflected in what we have been talking about today and what I'm hearing. Another person says, for starters, awareness of systemic and historic oppression and how that can impact a person's physical and mental health and their experience of healthcare structures. Again, some good insight. Another person said, respect coupled with humility for the wisdom of the community we want to work with, an open heart and acknowledgement of the effects of colonialism and oppression. Just what has been talked about here. It's really encouraging to hear some of these good words coming. To me, culturally safe research means when participants feel safe based on trust and respect, commitment to continued learning and shared knowledge. Each person's beliefs, physical and cultural needs, and reality is acknowledged. Wow, those were some pretty impressive answers to that question. And I think it's encouraging to all of us to know out there are people who are on that journey and well on their way on that journey. Any comments from our two wonderful elders on some of these definitions, shall we say, of cultural safety that's coming from the audience? Elder Ethel, your thoughts? You're smiling.
I think we've hit the focus of our intention today by the responses, and it makes me happy to know that there are people out there who recognize and facilitate, exactly what we are trying to do today. So I'm very thankful for that.
Oh, yes, it does warm the heart. Elder Arlene, your thoughts?
Yes, I think so too. Agree with what Ethel said. I am hoping that we are going to cover the sustainability question.
Oh, well, you'd like to. We have very brief moments, I guess. Then why is it important to ensure sustainability beyond research, and how can it be achieved? We sort of started to address that, but Elder Ethel, had you wished to add to that knowledge?
Well, my father always told me the power of the people is so important, and in order for our us to work together and do things together, we have to continue the partnership with our people and the research projects. I've learned that people's talk of life experiences are very powerful, and it's a true catalyst for change.
Oh, wonderful. Oh, thank you. And Elder Arlene, your thoughts on that?
Well, with that question, I was searching for how to answer that in my heart, and I thought, you know what, I'm just going to see what the definition of sustain is. And so the definition: to strengthen or support physically or mentally. And the synonyms are comfort, help, assist, encourage, support, carry, cheer up, hearten, give strength, and be a source of strength, and buoy someone up.
Wow.
Mm-hmm.
That
So
fits so well.
yes, so it was a very good. Almost nothing more needs to be said, but also a recognition that we're getting there. But to remember that we have a collective history of being an oppressed people.
Mm-hmm.
So we're not as well developed in our infrastructures, our numbers of scholars, researchers, writers, authors, doctors, lawyers, nurses, scientists, writers, etc., etc. But our people are moving, going to universities, strong, learning, becoming. The value of education is becoming a strong part of who we are as a people. But those numbers of helpers, writers, and all of those that I've mentioned are much lower than in the dominant society. And so sometimes we might not have what it takes to sustain a program or an idea or a project as it was laid out. So that's when the help, be it financial help by providing the people to make it happen, that's when that help is really needed to help us to sustain, as it's stated in this definition that I just provided. So I hope that the help to sustain whatever it is that we work on together continues to be there for our people, so that once a project or something has been started and put in place, that we get that help that we need if there is help needed. If a community is saying, we got this, we're okay, then that's the signal that what has been worked on is firmly in place, and it's okay to now bow out and to let that Indigenous group of folks manage their own affair.
Oh,
And so,
thank you.
yeah.
Thank you so much. That is really leads us all, helps us know that research is not, doesn't have a beginning nor an end. It is a continuing journey. Thank you all so much. This has been so heartwarming and enlightening. And with that, I wonder if Elder Ethel would be kind enough to deliver a closing prayer to close out our session in a beautiful way.
Okay. The prayer is a prayer of thanks. It says, Kaki Simoin. Kisemanto, Mr. He Kananaskamotin, Otaki Sikau Emayan, Mina Kakiao, Sawe Yemako Wisin Nikakwe Jimihitin, Bimatsuin, Miyo Machisuin, Pepawiwin, Mewi Tamawin, Kakiao Nesaka Hakinak, Kakiao Nechiwisimisak, Kakiao Nitsanak, Kakiao Newakumakanak, Kakiao Asinawak. Creator, I greatly thank you for another day you gave me. And for the blessings, I ask humbly for good life, good health, good luck, for happiness, for all my loved ones, all my children, all my blood brothers and sisters, all my relations, and for all people. Hi, kananaskamutin.
Yeah.
Thank you all for being here today and sharing your knowledge and your guidance. Thank you to our participants. I won't say too much more because so much has already been said. Thank you, and I hope everyone has a good day and is able to take some time to reflect on their learnings here. Thank you so much.
Bye-bye. Bye-bye.
Thank you.
Everyone. Have a
Bye.
good day. Bye-bye.